Break, and it is another beautiful Wednesday, and like we do it every time right here on Wednesdays, we like to talk about health and nutrition, and so we want to jump right into that today. And today we talk about a topic that I think that there's so much I don't know if it's myth, misconception, mara watu wanasema BMI si Africa, sisi ni sijui endomorph, sisi ni kubwa naturally, vitu kama hizo. So we want to kind of decipher all of this for you, and also as always, if you have any questions for the doctors hapa hivi unaweza wahala, si ndio? And allow them to introduce themselves, just get you watching them for the first time. Start with the first ladies first.
Hello everyone, my name is Dr. Elizabeth Waroe, medical doctor at Mata Hospital.
All right.
Good morning everyone, my name is Felix Okoth, nutritionist at Mata Hospital.
All right, so I guess what is jump right in there. Whenever people talk about obesity, you know, a very interesting topic because we hear, of course, cholesterol, good, bad. We hear BMI, we hear all these terms. So what can we, if we were to define it, what is obesity?
Okay, so in medical terms, obesity, it's the abnormal accumulation of excess fat in the body.
Okay.
Just that. Abnormal or excessive accumulation of fat in the body. Yes.
So it's not like in one specific area. Mtu akiwa na tumbo kubwa, sehemu ya obese ama
sorry. So when someone has let me call it a big tummy, that is what we call central obesity or abdominal,
central.
yes,
Okay.
or abdominal obesity. Yes, but in general, it's the abnormal or excessive accumulation of fat in the body.
So if somebody is, how do you know if you're obese? Because people have been contesting this fact of the BMI in terms of metrics ni ya wazungu, si ya wa Afrika. Yeah.
So yes, there's a parameter known as the BMI, in full the basal metabolic index. So it is not for one race, it is universal for all races, whether regardless of African or white. So the BMI is what it's a screening tool rather, and not a diagnostic test of defining health or weight. Yeah. So with BMI you have there are two parameters. There's the weight and the height. So there's a formula that you use. There's you check your weight in kilograms and height in meters squared. So if you weigh 70 kilograms, you divide that by your height. Say your height is 1.5 meters. So it's 1.5 squared. So you do 70 divided by 1.5 meters squared, then you get your BMI. And then there are categories of BMI. There are levels. So if your BMI is less than 18.5, then it means you're underweight. Then if it's between 19 to 24.5, then you're normal or you're healthy. Then 25 all the way to 29.9, you're overweight. Then there's above 30 to 40, you're obese, and then above 40, you're morbidly obese. So it's universal. It's not specifically for one race. It's what we use, but it's a screening measure or a screening tool. Yes.
And then are there other ways that you can measure obesity as well?
Yeah, there are several ways you can measure the body fat accumulation, and one of them is whereby we do the waist circumference.
Okay.
And the waist circumference generally measures the visceral fat which are on the lean body tissues, and whereby we'll use mostly the tape measure. Unapata mtu anafunga tape measure. So you measure the waist circumference, whereby we always say the waist of a man should not be above 94 centimeters. And if it's a woman, not above 84 centimeters. So if you're above that, there is more accumulation of fat that signals you that there are chances you are becoming obese. Apart from that, we also have the waist hip ratio, whereby you measure the smallest part of your waist, and then you also measure the biggest part of your hips, and then you divide the waist and the hips, and then you get the ratio. So the ratio, when you divide it, let's say someone is 80 kg, the waist is about 94 centimeters, and the hips is about, let's say, 100 centimeters. If you divide that, the answer you'll get, if the answer for a man is above 0.9, the ratio is above 0.9, then there is fat accumulation. So for a woman is above 0.85 of hip ratio circumference or ratio hip ratio, there is higher chances of obesity. Apart from that, there are also other methods that you can check obesity, even ultrasound, because ultrasound can show the fat accumulation. Even the CT scan can show fat accumulation, even the X-rays. But they are not common methods that are used to measure the obesity, which the common one which we use BMI, but you get that, like you have said, BMI is not one of the accurate methods of checking on weight, because yes, it shows fat, but it doesn't show us how much fat do you have. So it doesn't really determine if you are, it just don't really determine obesity. Because you see, there are those who are sportsmen, the gymnastics, those who heavy lifters, they carry a lot of weight and the muscles grow bigger. And if they weigh themselves, then automatically the weight will show that they are overboard than their height, but doesn't mean they are obese. The most important thing we say, check on the fat accumulation, and that's why people normally tell me, by the Willis, advise Willis apunguze kilo. But you see, they have not weighed you. Maybe your weight is genetical. But one thing we'll do, we'll check on your fat accumulation by measuring your waist circumference. Yes. So there are other methods that we can do apart from BMI.
Sorry, what about like when you? I guess there's also a time whenever you go for these checkups and then they draw blood, I guess, to check your cholesterol level. Is that also
yeah, so that's now medical. That's a medical way of trying to find out how your fat level is or your cholesterol level is in the body. So you go to a hospital or you go to a lab, and normally they want you to be fasted for at least 9 to 12 hours, so at least to get an accurate measure of your cholesterol in the body. So yeah, they draw a blood sample, and the test is called a lipid profile. So a lipid profile has a total cholesterol parameter. It has, I'll use some hard names. There's a HDL, which is the high density lipoproteins, what you're calling the good cholesterol. There's the LDL, that's the low density lipoprotein, the bad cholesterol, and then there's something called triglycerides, the very low density lipoproteins. So what you want high in your lipid profile is the high density lipoproteins, that's the good cholesterol, because it helps in the transfer of fats from the body to the liver where they can be broken down. Whereas on this other hand, the low density, which is the bad cholesterol, leads to accumulation of fat in the body or in the vessels. So you want the high density lipoproteins to be high.
Right.
Yes.
And so when you talk about then, because there are also sometimes when you see a percentage attached to sort of your fat, like you're saying. So is there are there specific parameters for that?
The percentage attached to the fat, mostly the other parameters that will determine that, and generally the cholesterol and mostly other measures which can also determine that. Yes, there are parameters that can determine that. Yes, like there is a current also test called the TMT, whereby you check the percentages now of the fat. Yes, there are also other measures whereby there is water weighing, whereby you sit on a chair and then they subtract your weight and the fat and everything. So there are several methods. Also the vacuum hair and so many more. Yeah.
All right, so when I ask, if you have any questions, I want to invite you to ask those questions. If you have any questions that are around, of course, weight and obesity, you can ask them. The SMS line is 22422, and the hashtag to use is Daybreak. You can ask that on Twitter, and you can also SMS us on 2242. Our lines are open for you, so you can ask your questions and get those answers as well. So there's also something interesting before we go deep into, obesity in terms of with adults. There's also something that I think is rarely talked about, which is childhood obesity. So what does that mean? Yes.
So there's also, childhood obesity, and let's begin with the prevalence of childhood obesity is actually quite high. It's a pandemic, or it's a world health problem, and there are modifiable causes and unmodifiable causes. The non-modifiable meaning the child has no control over those. So sometimes maybe when a child is born to a mother who has diabetes, that is gestational diabetes, or a child who has hypothyroidism. So those are some medical causes that can cause diabetes in a child. The modifiable are basically the eating habits of this child, the sedentary lifestyle, meaning there is little to no physical activity, long hours of watching television, snacking in between, the type of foods they eat and the quantity, and the quality as well. So those are some of the risk factors of childhood obesity. And in terms of trying to to know if your child is obese or not, we still use the BMI, and there are standard charts. There's one by the WHO and another one by the CDC committee. So there are those charts that you can use as a parent to try and figure out if your child is obese or not. So based on the chart, there's length for age, weight for age. So you check the age against the length or the weight against the weight. Based on those charts, you'll be able to assess or evaluate how the growth of your child is and how they are in terms of health, in terms of weight and all that. So childhood obesity is there, and it's actually prevalent, and it causes a myriad of so many medical diseases. Yes.
So what are some of those diseases that you can say are related to childhood obesity? And then also, what do you do? Because what if mtoto wako amesema tu anataka kuwatch TV, sasa amekaa hapo? Do you start going jogging with them?
Actually, you see, childhood obesity can lead to several things or complication to the child. We have on the respiratory, where we have pneumonia or asthma, and apart from that, we have on the psychosocial or psychological, and also children who are obese below 2 years tend to have poor or sluggish brain development. So this is a child who will have poor concentration or a short concentration palm, not exceeding an hour. So and then yet the child is obese. You're seeing the child getting obese. You're not taking approaches to help the child lose weight. And this is a child, when the child goes to school, you want the child to be number one, but they can never be that number one because their concentration and the brain span has a very short span. Apart from that, we have on the joints or the muscles, generally on the bones, weakened bones, low self-esteem, higher chances of cardiovascular diseases, type 1 diabetes, very high chances, and then appetite issues tend to come up. So for these children, is just a match of change behavior and match on diet, because if it is not genetically captivated and much of the feeding, then we can tend to see how often is this child feeding and how much is this child feeding a day. So if the child is feeding excess than what is required, then we'll give the child as per the weight of the child and as per the age of the child, what the child require. Apart from that, we'll also increase the physical activity of the child, and that's why I always tell mothers, as per different ages of the child, buy for the child toys as per the age, and encourage the child to play. Have at least 30 minutes or 40 to play with the child, so the child also get to burn fat. It's like when a child starts crawling, encourage the child to crawl because they use energy. And then do not make a child who is above 5 years sit on TV for more than an hour. Yes, so let them not sit for more than an hour. Then don't give them much of the junk foods. You get people give them sodas, the chips, they buy them the sweets, and this other junky food. Don't make them have more of the healthy juices, not the commercial juices, the lower carbohydrate, lower sugary food, but as much as a balanced diet as possible with the physical activity as per the age.
Yeah, so just because I was wondering if, because growing up in an African home, unaambiwa mtoto lazima kule. So then how do you kind of put a child on like something like a diet?
Yes.
Yeah.
So let me just add on that. For a child, I think children tend to pick up small behaviors as they're growing. So in a home, when you introduce a mealtime structure, so you introduce that you have to eat vegetables, you have to eat fruits from a very young age. This is a behavior that a child will grow with, and eventually it will become a habit. So if it's something that is instilled in the child from a very tender or young age, it tends to be something that grows with the child eventually, and it becomes a habit. So even when they grow up, it tends to be a habit of them to eat or choose things that are more healthier as opposed to the fast foods and all that. So it's more of habit forming, because children, when they're small, it's very easy to mold them than when they're teens or adolescents and all that. Yeah.
Maybe to add on top of that.
Yes.
Remember, children start feeding during breastfeeding, and then they start again the normal food at around 6 months. And we have something called the calories. Calories are energy that we get from food that gives our body and cells the heat to function. So a child between 0 to around 6 months should be on exclusive breastfeeding, because the breast milk has sufficient energy and nutrients for the child to grow and develop. And in absence of breast milk, then use formulas as advised or prescribed by the doctor. Okay, so a child between 0 to 6 months requires about 600 calories a day. 100 ml of mother's milk or formula has about 100 calories, 100 ml. So a child with 6 months should be, between 0 to 6 months, should be breastfed at least 8 to 12 times. So if this child is going to, at least 8 to 12 times, if this child is going to breastfeed these timings, then we are going to be sure they are going to achieve at least 600 to 800 kilocalories, which will be still enough for them. But a child, and their breastfeeding should be at least every 3 hours during the day. You wake them up, breastfeed them every 3 hours, then at night on demand. Then a child who is 6 months to around 8 months require 600 calories still. But of this 600 calories, because we're starting complementary feeding, because the energy requirement goes a lot higher, now you need to introduce the family food. So 400 calories should still come from breast milk. This is about 400 ml of milk in a day, 24 hours. So a child who is 6 months, if you are able to breastfeed 400 ml or 4 to 5 times a day, then you're 100% sure you're going to get adequate amount of calories you want from breast milk. So the family food only account for 200 calories. So half a cup of uji is about 80 kilocalories, or half a cup of any starch is 80 kilocalories. Right. And remember, this child will take uji in the morning around 10, and lunch some starch at 12, and then another starch in the evening. So 80 for breakfast, 80 for lunch, 80 for supper. That is 240 already. But in a situation now, you want just to put this too much of starch, you're not introducing vegetable to control the digestion, then there will be too much of energy uptake that will make to excess energy that can lead the baby being obese. Or you start introducing, and that's why I tell mothers, be very cautious when you're introducing protein. A child who is between 6 months to around 9 or 8 months require about 1.2 grams protein per kg body weight. And this child between 6 months to 8 months is roughly 7.5 kg to around 8 kg. So they require around 8 to 9 grams of protein per day. And remember, breast milk has protein. We said it also have 1.2 gram protein per kg per 100 ml. So 400 ml will have 400 grams, around 4 grams protein. So we are remaining with around 3 to 4 grams protein. Half a cup of uji has 2 grams of protein. So, or half a cup of any starch, but we're giving starch like half a cup, like 3 times. That is around 6 grams of protein, plus the 4 will be 10 grams. The protein is already excess. So if you give too much protein, and mostly why we say do not give cow milk, it has a protein below 1 year, it has a protein called isoleucine. So this is a type of protein that leads to faster muscle growth and can lead to obesity. That's why unapata ndama kinyonya within some days in a tembea it's bigger. So tend to control the protein, because they can also impair the insulin function and lead the child to obesity and even diabetes. Yes.
All right, so of course, if you have any more questions about child obesity, you can go ahead and ask. I want to move on now to obesity in adults, and what are some of the dangers, because people always say that nimeishi hivi nakulanga junk kila siku, something must kill a man, all these things all these things that excuses that people have, and they say that no, but I feel okay, I don't have any symptoms or stuff like that. Does it have symptoms? And then what are some of the dangers as well?
So yes, there are dangers of being obese, and I'll begin by saying any person who's overweight or any person who's obese has a certain level of insulin resistance in the body. As much as that has not progressed all the way to diabetes, you have a certain level of insulin resistance, which if it keeps increasing can lead you to diabetes. So some of the medical conditions that can arise from obesity are type 2 diabetes, as I mentioned. There's hypertension, there are cardiovascular diseases, which to an extreme can cause myocardial infarction and then heart attack, what we know as heart attack. There are other things like kidney stones because they contain cholesterol. There are things like respiratory tract diseases like asthma, obstructive sleep apnea, where you lack air in the middle of the night, you wake up to gasp for air at night. So there are myriad of so many medical conditions that can arise from obesity. So you may be thinking that you're fine and you're not having any symptoms, but it's something that is brewing. So with time, it will definitely lead to the consequences. That's why sometimes you find that someone woke up very well, they went to work, but then when they're at work, they get a sudden chest compression, and then you hear they died of a heart attack. So that's because the process has been going on slowly inside the body, insidiously, and themselves they don't feel anything. That's why they say they're okay. Yeah. So It's something that has to be done. You take the initiative to treat it early enough. Yeah, so don't say that you're okay.
Yes. So when should you see a doctor? When should you say that, hey, because people use many things. They say, if come as visitor shoeless, okay, that's now there's a problem.
Willis, I would say, apart from the genetics, apart from lifestyle, the other causes of obesity that can also lead you to see the doctor. And in lifestyle, we have the nocturnal diet, whereby you see some people tend not to eat during the day, but during the night they eat too much. Yes. So it can be either due to depression or any other thing. There is also another one called the yo-yo method. And this is one of the methods that most people, the yo-yo eating that most people tend to use. You get that you really want to lose weight and you start restricting your diet, you lose weight. But after you lose weight, you cycle back to what you are eating. Then you cycle back to again losing weight. That is one of the ways of also obesity. Apart from that,
so you lose gain.
Apart from that, we have the other one, whereby we have you see the hypothalamus. You see, hypothalamic. Hypothalamus is a part of the brain that controls most of your moods, control most of your stress hormone, also even the appetite. So when there are surgery, brain surgeries, or you have radiation, or you have the medication for cancer patient, it tends to affect that part and can lead you to appetite that make you gain a lot of weight, hormonal changes. We also have, apart from that, we have the medications. And medication, we have antidepressants for depression. We have for psychotic patients. We have corticosteroids for inflammation, and so many more that can also lead to obesity, among so many more. So as per your question, you ask, how will you find out you are obese? And one of the areas, what should you do? There are symptoms of obesity. And you see the fat accumulation, when you start having, you're depressed about how you are. There is also the acne issue, right? Overeating, too much sweating, too much heartbeat, poor breathing, and so much. So when you feel that and you see more accumulation, you start becoming heavier than normal, and also sleep disorders and so much, then it's a high chance you start going to the hospital. But complication, as doctors said, there are complications that happen on the respiratory, the asthma, and all the rest. There are complications that happens on the neurons or the nerves, the hypertension, the blood clots. There are those which affects also the fertility and also the menses of women and so much. Yes, so it's good just in case of any complication that you're not sure of, because you can be obese not knowing. Go for checkup.
Right.
Yes.
And so if you go for a checkup, what's going to happen? What are some of the, how do you treat it? Yes.
So once you go to the hospital and the doctor does, there's normally just, mostly you start with a physical examination, take a good history, then now do the blood test, which is the lipid profile. So if you do the test and your levels are found to be high, depending on the levels, so you can be borderline high. So if it's borderline high, the doctor will advise you on management on lifestyle. So you do lifestyle management where you'll do exercises, you'll be advised on the right diet to use, avoiding the sedentary lifestyle. So mostly lifestyle management. But if the levels are a bit too high, now that's when you add medical intervention. You give medications such as statins, basically the medications we give to treat high cholesterol levels. Yes.
All right, and so then there are also many popular, well, not popular because popular would mean it's been done a lot, but it's expensive. People always want to go also for the surgeries as well to help. How does that work?
Apart from that, maybe just to add on top what Dr. Arya said, on the medication, they're medication for treating obesity, and mostly what they do is just some of them remove the fat before it's absorbed through the stool, so the fat is not absorbed. Apart from that, some of them also tend to reduce appetite, or some of them are very high fiber content that tend to make you full. But as we have said, there are also surgical methods of weight, but mostly surgical methods are done to people with a BMI of 35 to 40.
So the extreme cases.
The extreme cases, not this other normal obesity, the type 1, to the type 3, whereby the type 1 is whereby the BMI is about 30 to 34, and type 2 BMI is about 34 to around 36.9. Then above that, we will say now you require the how do we call it? The bariatric surgery,
yeah,
where it tends to reduce the volume of the stomach or bypass some digestive process in the stomach so that you don't digest the fat, or it makes you full as fast as possible. And there are different methods of bariatric surgery that doctor can explain.
Right.
Yeah, so as Felix is saying, yes, there are those types of surgeries that you do, and the medical indications for them are when you're morbidly obese, that's when your BMI is above 40, or when your BMI is between 35 to 40 and you have a comorbid condition. Let's say you have hypertension, you have diabetes, you have cardiovascular diseases. So that is also a medical indication of bariatric surgery. So there are different types of bariatric surgeries, and the main thing that happens is reduction of the portion of the stomach, something we call gastrectomy. So the stomach is, let me just use layman terms, it's cut. Yeah, so whatever is left is just a pouch, about an ounce. So that pouch, when it's more like that, it means you'll eat less and you get satiety early. So it means the amount of food that you're eating is less and the absorption also is minimal. Yeah, so there are different types of bariatric surgeries. There's the Roux and Y. There's another one called banding, where you use laparoscopic surgery. So you don't have to open up the whole abdomen. So there's a band that is placed on top of the stomach outside, so it constricts the body of the stomach. So depending on how much you want left, there's normally a cutaneous we call it wire that's left on your stomach. So you can inject some fluid which can inflate the band, or remove some fluid to reduce the band. So yeah, so that's some of the surgeries that can be done in bariatric surgery, and mostly it's best reserved for those people who are unable to lose weight with non-medical, with non-surgically. Yeah, so you've tried exercise, you've been unable to lose, you've tried diet, you've tried even some of the medication, the tablets, and you've been unable to lose weight through that. And if it's morbid, like if the BMI is all the way to 40 and that, so those are the medical indications.
So pesa isikusumbue uende uanze kufanya surgery.
It also have side effects.
Yes.
Yeah. And some of the side effects, because you are bypassing the digestive tract, and they're also using either the endoscopy, they're using endoscopy is whereby a tool like a picture that takes the picture of your stomach is inserted. So this can irritate the gut and affect the gut, good bacteria in the gut. So you can have still digestive issues or poor fatty vitamins absorption, vitamin A, D, and K. So poor blood clotting and poor immune system and so more, and other complications can also occur.
From that?
Yes.
All right. So as you digest that, we have some questions that people are asking. I want to just see. Someone here is a viewer on SMS is asking, is obesity a sign of low body metabolism?
I'd say yes. So you find some people who have low metabolism, meaning that they can eat low amount of food or eat food in less quantities, but still they gain weight. And that's because their metabolism is low. They're not able to break down whatever it is they're eating, the calories, the fats. They're not able to break them down in the usual manner. Yeah. So obesity rather can also be defined as imbalance in energy expenditure. So whatever it is, the calories that you're intaking are not being expended as they should in the body. Yes, so that's also another way to define. And yes, it is a sign of low metabolism.
All right. A viewer says, are only fat individuals obese? I was told by my doctor that I was obese, but physically I wasn't fat. The doctor never explained it to me. Please enlighten me.
And that's why we explain that for you to be considered obese, there are several factors that has to be checked on. And as I said, it really depends. And as we defined obesity earlier, it's excessive fat accumulation that poses you to risk of most of the lifestyle diseases. So if you're huge and Similarly, you don't have fat accumulation. You have lean muscles generally, but your age, your weight is higher than your height. We won't really say you're obese, because remember, in the weight itself, there is the water content in your body. There is also the bone density factor and the blood volume factor. And that's why we have nowadays, we have current machines which are not the normal BMI machine that we use. They're called body composition machines. So the body composition machine measure the total body fat, the total water percentage, the total weight as per your age, and it subtract it all and only leave you with the fat content. So I will tell our audience is that the most important thing is, let's do the waist circumference check if it is in the normal range. And as Dr. said, we can also do the cholesterol checkup to check the fat itself. So if the cholesterol levels are normal, the waist circumference is normal, and you have lean body tissues, because you can also not have a tummy, but you have a bigger hips than normal. Or you cannot have, but your arms have fat. So let's check where the fat is accumulated. But if it's not there and the weight is higher than height, then we will not say you're obese.
Right.
Yes.
All right. Emmanuel Ekuom from Lodwa says, my child is 9 years and weighs 44 kgs. This is alarming. What is the best way to make him reduce weight?
Okay, normally I tell people to check for weight for a child between the age of 1 year to about 10 or 15 years, is whereby it age times 2 into bracket plus 8. So a child who is 9 years is 9 times 2, which is how much? 18 plus 8 is 26. So this child should be 26 kg. So how much weight does the child
44.
do? 44 is obese, okay? And obesity of a child is not much determined by the BMI. Yes, the ranges are the same, but it's not the normal calculation, because children's pattern height grows faster than the weight. So as the doctors say, we use the CDC, the weight
charts.
Growth charts, okay? So for this child, as we have said, check what is causing your child to be overweight. Is this the unhealthy diet you are giving this child, or inactivity that this child is having, or does this child have any condition that is leading to this? And this is a child that should be taken for a review as fast as possible to prevent complications that can occur. Yes.
All right. So, Simatwa from Kapsoya, is too much consumption of alcohol a cause of obesity? I've seen most alcohol consumers with a potty, the beer belly, as it were. Is it a factor?
I'd say yes and no. So it depends with which alcohol. There are those alcohol like beers, beers, those ones that have the wheat, the belly, all those can definitely cause the abdominal obesity or the central obesity. But others like the whiskeys, the spirits, those ones, no. So too much consumption of alcohol, yes, can cause obesity, but depending on which type of alcohol you're taking, because beers definitely do cause that central obesity.
And maybe to add on top on that, alcohol is one of the type of things that we take that we say have empty calories. And in empty calories, we say, yes, they have calorie content, but this calorie content has no much benefit to the body usage of energy. So they are going to be used as excess. So yes, alcohol can make one obese. And mostly, like we discussed, alcohol with high calorie content will give to excess energy that can lead to fat accumulation. And this fat accumulation can lead you to the excessive overweight. So over time, excessive consumption of alcohol, yes, can lead to obesity. It can also alter your insulin production. And with altered insulin production, uptake of energy will be impaired and excess will be stored as fat. Yes, it can do that if it is done for a long time.
Yes, so maintain. All right, viewer, you didn't leave your name. Say, how does a mother start losing weight postpartum without interfering with the child's growth? How should one start with dieting? Okay.
So I think I'll help in answering that.
Right.
We don't really recommend weight loss during pregnancy, because a pregnant mother needs to gain weight because the baby is growing, the placenta is increasing, the uterus itself, the body fluid, the blood, and everything. So when a mother is pregnant, if you don't want to gain weight, I'll answer your question, do not lose weight, because in a normal BMI, a pregnant mother needs to gain about 11 kg to around 16 kg. That is the breast, the uterus, and all that. But obese mothers can gain about 11 to 14. Underweight about even 16 to 22 kgs. about 40 weeks of pregnancy. Now, after delivery, there is that weight that remains, and is the body fat accumulation, the lower fat, that accounts for around 3 to 4 kgs. But we advise, due to hormonal changes and everything, the baby requires nutrition and nutrients that you are getting from your food. Weight loss during breastfeeding up to around 1 year of age is not recommended, because if you start restricting energy or food or nutrients, then you will impair the requirements of the baby. So what we tend to advise this mother, increase your physical activity that you can make. Then apart from that, tend to avoid much of the high caloric food or high fatty food or high sugary food that can make your energy input to be higher. Mostly the sugary and the junk food. Eat more of the healthy food with the recommended portion, and exercise.
And exercise.
Yes.
All right, so for those considering fat reduction ways like injections and liposuction, is it dangerous? And what would you advise for someone who is fat?
So for such measures, so if someone is trying to lose weight through such surgeries are called cosmetic surgeries. So yes, there are risks. So mostly people go for them for cosmesis. They normally don't have a medical indication, because the medical ones are the ones I had mentioned earlier. So the liposuctions, the tummy tucks, and all those are mostly for cosmetic surgeries. The dangers can be there, so one has to go to a known plastic surgeon who is able to do it in the correct manner, sterile, because most people tend to get infections. Sometimes they don't even work, so you have to go again for more injections or for more surgery. And some people even die, sometimes even on the operating table, not to scare people, but have a clear indication for you to go for that surgery, because most of them, they're done for cosmesis. So yes, so that's basically it.
All right, yeah, be careful out there. When one is obese, I guess, what happens to the bones? Do they also swell? Do they maintain their size? That is wodoketo.
The bones maintain their size. And that's why when one is obese or overweight, there are issues of backache, because you get the spinal cord doesn't increase in size, and is the one that just make our body into their correct composition. When one is obese, and that's why there are chances of arthritis. So arthritis is inflammation of the joints, right? Or the general joints. So you get that is too much pressure, because the bones doesn't increase in size.
Right.
So that weight gives too much pressure to the bones, and that friction that can lead to bone issues, or even, like we say, the bone degeneration. So the bones doesn't increase. It's just the flesh and the fatty tissues that increases, that now overworks the bones themselves.
All right. After how long should I visit a doctor for checkups? I guess it's probably full body. How long?
Yeah. So ideally, one should do yearly checkups.
Okay.
So yearly checkups that involve just a total body check. You check the kidneys, you check the liver, you check the heart, and including there you do a lipid profile. So yearly checks are normally advised. So yes, yearly.
There's somebody there who put a question, but we didn't ask it. Somebody asked if they can gain a kg overnight. Is it possible to gain a kg overnight?
I would say that is not recommended. The highest recommended weight gain is about 0.9 grams a week. That is okay. 800 to 900 grams a week. But for weight loss, we say around 2 to 3 kgs a month. So gaining, you can gain 900 grams a week. 900 grams times 4, that is around 3 kgs.
3 kgs, yes.
3 kgs a month, yeah.
But
a week is not good.
both.
Yes.
Right. So now when it comes to that, then, so that people who maybe are watching and they cannot, say, afford the surgery, what are some of the things they can do in their diet to kind of help them, move forward, or what other ways can they, deal with obesity? Maybe
to answer that, the diet mostly is restricted in a way so that you restrict your energy, caloric content, or the energy-giving food content, not to surpass your requirement. And in a normal adult requires about 2,500 to 3,000 calories. But when you're losing weight, we restrict your calories to about 1,000 to roughly 1,500 calories, so that you get less than what you require, but the body burn more the fat itself. for energy and other excess of it, so that you don't have the excess, but the body can burn whatever is already stored. So around 1,000 to 1,500, but some people goes up to around 500 calories, which might not be also very good for you because it can impair the normal body function of organs and everything. I would say the least can be about 800, but you cannot start with it. So you can start with the 1,500 for the first 2 or 3 months. Then after that, you go to 1,000, slowly to around 800 calories. But there also, the diet is mostly to restrict calorie, whereby you also avoid anything that has excess energy that can lead you to excess fat accumulation or excess energy, body storage, where we say the fast foods, which we have always discussed over and over, the sugary foods, the fatty food, anything with the excess calorie. Apart from that, the other methods of also the diet itself. So we'll balance your diet through the day, so that either if we say 1,500 calories, we say we'll give you about 800 calories for breakfast, because your body metabolism and expenditure is higher during the day. So 800 calories during the day, we can give you either 400 for lunch and the rest for dinner. There is the DASH method also, which is the dietary approaches in preventing hypertension, which is much of the low-fat food, high veggies, and more of the plant protein. There is also the intermittent fasting, which is restricting calorie, not more than 500 to 1,000, which is okay. But the problem is the intermittent fasting actually, as per the current information, is very healthy. But it's only healthy if you know the caloric requirement on your restricted diet, which is 500, 600 calories or 1,000 calories. So we have the 14-8 method, whereby you eat for, you don't eat for 14 hours, but you eat for 8 method. There is the alternate day method. You take food on alternate days. There is even the water method. The water method is whereby you take vegetables from 4 a.m. or morning hours up to 12 p.m. and then your first meal is only 4 p.m. and then you don't take anything up to the next day 4 p.m. And then the 16-8 method, you don't eat. Which
is the most common, right?
Yes, you don't eat
because
for 16 hours. Yes. and there is even there are so many type of fasting.
Right.
Yes.
And so maybe lastly, because we don't want to close out anybody else, you know, for people who do want, they're watching, they think they can, you know, go for the surgery. What are some of the, like, how long does it take for one to recover after? Do you lose weight immediately? What happens?
Yeah, so the effects or the outcome is normally immediate, because the surgery is done there and then. So the effects are immediate. But what you're advised by your doctor is to continue with a lifestyle that will maintain those results. So meaning the amount of food you eat will be reduced. Exercise is also very important, maintaining physical activity. So even after the surgery, it does not mean that now you rest or you continue, or you can eat anything, yes. So you have to